Hi, I'm Dr. Ahtsham, and today we are going to discuss about the teaching stations. That's the most interesting thing for me, the thing I love to do. So, the teaching is an interactive process, as you know. If that is not interactive, this means that it's like delivering a sermon and it's not a teaching at all. So, here I'm going to tell you how you can effectively utilize your time in the PLAB station, PLAB teaching station. So, let's start it. So, first of all, you need to greet with the person, okay? Might be a junior, might be a student, okay, who wants to learn something. I'm going to give you an example of teaching a urine dipstick to make it easy for you to understand. So it starts with the greeting. You need to introduce yourself simply by saying that I'm Dr. XY or whatever, and may I know your name? So with the greeting, then you can have a little bit of chat, okay, about the journal things, that how's going, okay, what you are doing, what you find most interesting. When it comes to the teaching, okay, you need to ask there what exactly he or she wants to learn, okay, and what he already knows about, because you need to utilize your time, okay, and you cannot teach each and everything in a short time. So you need to have an idea that from where you need to start and what he or she already knows. So what he already knows, say for example, and what he wants to know, okay, and why he wants to know, okay, just to develop, um, just to make it a little bit interactive. Now, if you talk about the teaching station, there are a number of things over which you can talk. Say, for example, it's a urine dipstick. Okay, so you can talk about why you are doing this procedure, why you are doing the ECG. Okay, that's one thing. Why you are doing the urine dipstick. Then you can talk about the instruments. Okay, the things which are needed for the urine dipstick. Okay, you can show and you can talk about that. The next thing is you can talk about the procedure, how you're going to do that one, and you can practically tell that how we do it, and then you can interpret the results. Okay, that how to interpret the results. So there are a number of things you need to ask. Okay, and you can effectively utilize the time that's given to you. Okay, so you have so many things. Don't go blank. So many things to talk over. Okay, just talk in an order. Okay, do not do the things randomly. Now the next is that, okay, whenever you are teaching, okay, always keep on asking the question. Say for example, I'm going to tell about something. A better way is to ask the question. Okay, if the person that is actually um, able to answer that one, encourage. But if not, okay, do not discourage. Okay, you need to answer that one and encourage at the same time. Okay, so ask the question. This is one way of teaching. To make it interactive, you need to ask the questions. Okay, you want to tell about something, okay, do not tell directly. Okay, there are other things which you need to tell directly, but the things which you can ask the question and make it a little bit interactive, go for that by asking the question. That, for example, why you know why we are doing this test, what's the significance. Okay, if he or she tells, encourage. If not, you need to tell that one and encourage at the same time. Now, always check the understanding. That is very important. Okay, do not go through your teaching like that. You have delivered a whole sermon and you are not asking anything. If you are doing such a kind of things, okay, that would be a sermon. That would not be a teaching. By asking the questions, checking the understanding at that level, you are showing that you have the good teaching abilities. Okay, and lastly, at the end, always encourage, okay, to ask the questions. If there's any confusion at the end, do that thing, okay? That do you have any confusion, okay? Any question, because if he is having the confusion, this means that he has not understood. Okay, so at the end, you need to ask that one, so that if there's a little bit of the confusion, you need to answer that one as well. So this is how you can go through your situation. Thank you.